All right, so I think I'm close enough now. You're going to record it? Okay. Why? Perfect. All right, so we're going to get started, but for those of you who are here in person, feel free if you want to get up and grab some snacks. The washrooms are outside, so straight across from the door almost is the male washroom, and around the corner to your left is the female washroom. Okay, so you can feel free to do that. So I'm Natasha Clark, one of your international student advisors. My role is to manage the foreign health insurance. So if you have questions about health insurance, typically they'll get directed to myself or to Susan at our front desk. And I also am a regulated Canadian immigration consultant. So another part of my job is to give immigration advice to students on their study permit and their work authorization. But myself and the other immigration advisors are going to do a separate session on that on Tuesday. So hopefully we'll see you there. Okay. So my pronouns are she and her, and I am a uninvited settler here on the traditional lands of the Beothuk, Mi'kmaq, and Inuit, the province of Newfoundland and Labrador. And that's something we do to start all of our sessions, is to begin with a land acknowledgement. So we acknowledge the lands on which Memorial University's campuses are situated are on the traditional territories of diverse Indigenous groups, and we acknowledge with respect the histories and cultures of Beothuk, Mi'kmaq, Inuit of this province. And for those who are watching online, if you're not in the island of Newfoundland or in the province of Newfoundland and Labrador, we certainly encourage you to reflect on the lands where you're located. So a land acknowledgement is something that we do at the start of all of our sessions, and it is in itself rooted in Indigenous tradition. Right? Indigenous people have quite a strong connection with the land, and they frequently will engage in this type of land acknowledgement. But we do it here at Memorial as a way to work towards truth and reconciliation with Indigenous peoples. So Canada has a very difficult history and past in terms of how settlers came and treated Indigenous peoples and erased and took their land essentially. And so as a colonial institution, as Memorial, a settler institution, we work to bring that truth as a way to work towards that reconciliation. All right. So before we begin, I'm going to present basically on health insurance. It's a whole topic, and I'll tell you what kind of things we're going to go through. But at the end, there'll be tons of time for you to have questions. So this is a hybrid event. So we have some people in person who might have questions, and then we'll skip back to online. So for people who are joining us virtually through WebEx, if you have a question, you want to type it into the Q&A section, and we'll address those at the end of the presentation. If you happen to have any technical issues or concerns at this point, you can use the chat function. But outside of that, we're not going to monitor it for questions until the end. Okay. So essentially, today's session is all about health insurance. And so by attending it, what we expect you will learn are a few things to be able to describe the difference between the different types of health insurance. So foreign health, MCP, and the student union plans. To be able to describe what might make you eligible to opt out of the foreign health, which is about canceling the foreign health, and to describe how you go about doing that. And let us know what the deadline is to do that. And we'll be talking about GuardMe, which is the provider of the foreign health insurance. They have various services, so we'll discuss that as well. And we'll also talk about ways to seek medical care. So a lot of it about health insurance itself, but then how do you use that health insurance? What services you might be able to get from it, as well as how to seek that medical attention in Canada. Okay. So we think it's worth doing a full session on health insurance because it actually can be quite complicated, right? And part of what makes it complex is that there are different types of health insurance, right? That you may be eligible for or have access to as an international student at Memorial University. And so the first thing I'm going to do is to talk about the three different types. So the first one is what we refer to as foreign health insurance, which is through a provider called GuardMe. The second is medical care plan, or MCP, which comes from the province of Newfoundland and Labrador. And the third would be insurance plans that are administered within the institution, but by the various student unions. And they're with a company called Green Shield. Okay. So first of all, the foreign health insurance. The foreign health insurance refers to basically like the line item you will see on your student financial account menu. Okay. So essentially all registered international students have to have health insurance. And the insurance that an international student gets automatically is called foreign health insurance. So it's automatically charged to you whenever you register for a semester. So if you've registered for the winter semester for a course or a program, and you're using the Memorial Self-Services menu, if you flip over to the Financial Services menu, you will see a charge there, and it says foreign health insurance. So that's what I mean by the line item. That's what you see. Okay, but the provider of the foreign health insurance is a private company outside of Memorial that we have a contract with, and that's called GuardMe. All right. So for students who are doing full degree seeking programs, you will pay that foreign health insurance along with your tuition fees and along with your other student services and ancillary fees. For students who are here on an exchange, you likely pay your tuition to your home university, but you do have to pay that health insurance fee to Memorial. So if you look through your my.mun.ca at your financial account, that's likely the only charge you might see there, okay? And that payment can be made through our cashier's office. And there's various ways to make that payment. So you can pay by credit card, but you do get charged a fee to do that. If you do online banking, you can pay that way, or there's different payment methods like Convera, I think, to pay your fees. But that's all through our financial services team. So questions about that, we can certainly address it. We manage at the internationalization office this insurance. So if you have any questions about the foreign health, you can certainly ask us. And as I mentioned, the provider of that insurance right now is a company called GuardMe. Okay, and they've been providing that insurance with us since about 2003. But it can change because we do go to market every now and then. And it is charged to you every semester you're a registered student. Okay, so it's semesterized insurance. Right now we're in the winter semester, and so you are paying $261.59 for coverage. That coverage goes from January 1st to April 30th. Okay, if you're registered in the spring semester, you'll be charged this again, and the coverage will go from May 1st to August 31st. Okay. If there's a time when you're not a registered student, you're not automatically charged or set up on insurance. So that means your insurance will expire, right? But if you plan to be here in Canada, you should have insurance. And there are ways with GuardMe to purchase it like as a gap student for that time in between, okay? And if you're here as an exchange student and you're going to stay beyond April 30th in Canada and travel, you could also buy it for a certain number of days afterwards if you wanted to have that coverage. Okay, so it's just important to know that it is based on the semester and you're only charged that insurance if you are registered. Okay. Now, what does it cover? Not every insurance is going to cover 100% of your healthcare needs all the time, right? Every insurance policy is going to be different and it won't cover absolutely everything. To have a good understanding of what your foreign health insurance with GuardMe will cover, I describe it as a comprehensive emergency medical insurance, okay? So when I say comprehensive, what I mean is that it will cover different stages of your healthcare. Okay, so you might feel ill and your first step might be to book an appointment to see a physician in their clinic, right? That physician might provide you with a prescription for medication that you would then take to a pharmacy and get filled. Perhaps, you know, it is a very emergency situation and you need to visit a hospital, right? You make an emergency room visit. Perhaps you have diagnostic testing, like an x-ray done or something like that, okay? That's different stages. So seeing a doctor, getting prescription medication, maybe getting referred to another type of paramedical service like a physiotherapist or chiropractor or something. So it covers kind of like all of these different stages. But the second part is the emergency part. It only covers those things, typically in what we refer to as a new and emergent situation, okay? So what that means basically is that it only covers you if you need it, right? So if you have some pain or some suffering that you need to have alleviated, it can cover that. It can be that serious emergency, like a broken bone, that will bring you to the emergency room, but it could also be perhaps a bacterial infection or something where you might need to see a doctor and get a prescription for antibiotics or something like that, okay? So that's kind of the emergent. It's like just in case, because it has several exclusions in the policy. Mainly, it excludes like a pre-existing condition or anything that's chronic, right? So if you had a health condition, say you're diabetic or asthmatic or something, perhaps you need prescription medication on a monthly basis, or if you're in Canada and you develop that sort of thing. The initial kind of diagnosis certainly will be covered, but the ongoing care for a chronic or pre-existing condition is typically not covered by this policy, okay? If you have a pre-existing condition and you have to take medication that they deem to be medically necessary, there is a part of this policy that you might be able to get that benefit from, okay? But in general, it only covers like a 60-day supply of medicine. So it's just for that reason. The medical part of it is that typically there's a difference between like a health insurance and a dental insurance, right? So this is a health, it's not a dental plan, although it does cover some emergency dental, like if you had extreme dental pain or had to have a tooth extracted, okay, it would cover that. But it's not going to cover like a dental checkup, right? Which some people have dental insurance that will do that, okay? There are aspects of it, of the policy that are non-emergent, right? So as I said, primarily it's meant to cover you just in case, but there are parts of the plan that can be non-emergent. If you have that medically necessary pre-existing condition, there can be coverage. And also there's other benefits like it'll cover an eye exam every 2 years, up to $120, but it doesn't cover glasses or contacts, for example. It will actually cover like one physical exam a year, so just a checkup without maybe having a reason. It will cover that as well, okay? So it is really important at this point, I think, just starting off, to have a general idea of what your insurance covers. If you stay enrolled in the foreign health insurance, you will get more information about the policy. So there is a policy summary, there's a policy wording document, and I would encourage you to kind of read through that. And having this basic knowledge hopefully will help you to interpret that insurance policy a bit better. Okay, so that's it about the foreign health insurance. Then we'll move on to MCP, which is medical care plan. So this is very different from the foreign health in a few ways. First of all, the foreign health is from an insurance company. So it's, you know, it's a private insurance, you pay for it, right? It's a for-profit company. MCP comes from the government of Newfoundland and Labrador. So it's a public service. So we refer to it as public health insurance. It's also free. So there's no cost for this insurance. It's also very different in what it covers. So the foreign health is kind of comprehensive emergency health care. Your MCP, I would describe as kind of your basic health care, okay? And what that means is it covers you to see a physician, so a medical doctor, or for services delivered in a hospital. Okay, so it wouldn't cover then prescription medication. It wouldn't cover other services that are not from a medical physician. So not a dentist, not an optometrist, right? It covers the things that are most common for people seeking healthcare, which is typically, if you're not feeling well, you first visit a primary care physician. So like the cost of that visit would be covered. If you had to be referred to the hospital to get some diagnostic testing, like an ultrasound or an x-ray, it would cover that. If you had to be admitted to the hospital, have an operation, most operations covered. If you made a visit to the hospital to the emergency room, it would cover that, okay? And those are the more expensive things in the healthcare system. So that is what is covered by MCP in general. Another major difference is that you don't automatically get MCP. As a registered international student, you automatically get the foreign health with gardening. But MCP, you have to be eligible for it, and not all international students will get MCP. You have to be eligible, but then you also have to make the application for it, okay? So to be eligible, you have to be a full-time student enrolled at a post-secondary institution in Newfoundland and Labrador, so at Memorial. You have to have a valid study permit that's valid at least for the next year, the next 12 months. And you have to be a resident of Newfoundland and Labrador. And what that means is essentially you have moved here and you intend to reside here for the majority of the year. So more than 6 months out of the year. So this is where I say, as an exchange student, particularly for one semester, it's the foreign health. That's essentially your health insurance option, right? This MCP would not be available to shorter term students. It's designed for people who are establishing their residency here to pursue a program that's at least a year long, okay? So if you are eligible for MCP, you should definitely apply. So you then have to make the next step to make the application. And even though you have the foreign health, I still encourage everybody to apply for their MCP. It is something that we communicate to new students as something you should do in your first kind of week or two of being here, right? Open a bank account, get your MCP, it's all part of it. And Bahar and her team help to facilitate here MCP clinics. So MCP will be on campus tomorrow, I think, and Friday, yep, and there's other dates on the website. And you can bring your documents and submit your application for MCP at the clinic. And they can check it over to make sure it's complete. Because of course, to apply, you have to demonstrate that you meet those eligibility criteria, okay? So there's an application form that you'll need, and that's on the MCP website. We have some here, right? And you can fill it out. It's a one-page form. You have to show proof that you are enrolled so that you're a full-time student. And that should be proof of enrollment that was issued within the last like 30 days, right? So you might receive soon an email confirming your enrollment, or you can request an enrollment letter through your self-service, okay, to show that. And you need to have a copy, a photocopy of your study permit, because they'll want to take that with your package. That's to make sure that you have that 12 months. And you'll also want to provide a copy of your passport. So the biodata page with your photo, that's proof of identification, okay? So that's typically what's needed to apply for MCP for you as a student. If you have your family with you, and that would be a spouse or dependent children, you can include them on your MCP application form as well, but they also have to have an immigration document that's valid for at least 12 months, right? So if they came on a shorter visa, they might not be able to get MCP at this point, right? It has to be valid for that period of time. Yeah.
Where is this office? MCP's office.
MCP's office is located at 45 Majors Path, which is a street in kind of the east end of St. John's. Now, they are not open to the public, so you can't have front counter service. But one way to submit your application outside of coming to a clinic is to either mail it or to drop it to them. They do have a drop slot there. Yeah.
Mail IDs for them.
I'm sorry?
Mail ID for
Sure, yeah. So it's on the application form, their full address. So it would be, you know, their street address, their city, province, and then they have a postal code. So on the application form, and there's some behind you, the full address is there. Okay. All right. So we've talked about foreign health insurance and we've talked about the MCP. So this would be the third type of health insurance, which you might have or might have access to as a student at Memorial. And that is a health insurance plan that's administered by your student union, okay? So as a student at Memorial, you are a member of a student union, which is a group of students that represent your interests on campus. You pay union fees for their services. They help to advocate for student rights and engage with the university on those matters, okay? There are different student unions at Memorial, and which one you belong to will depend on your level of study and your campus of study, okay? So if you are a graduate student, regardless of your campus, you are a member of the GSU, which is the Graduate Student Union, okay? If you are an undergraduate student at the St. John's campus, you are a member of MUNSU, which is the Undergraduate Student Union. If you're a student in a diploma program at the Marine Institute, there's MISU. And if you're an undergrad student at the Grenfell campus in Corner Brook, there's the Grenfell Campus Student Union, the GCSU, okay? Now those unions do many different things. One thing they do as well is administer a health and dental plan. And the health and dental plan administer, their health and dental plan is all time. Canadian and Canadian will have MCP by virtue of their residency and citizenship status. And the Green Shield insurance then is designed to supplement that provincial health care. Because remember, it covers, I mean, a lot, but just kind of your basic to see a doctor or go to a hospital. So most people, if they can afford it, will pay a private company for additional insurance to cover things not covered by MCP, like prescription medication, like dental care, like an optometrist, or physiotherapy, chiropractor, all that sort of thing, right? So our Canadian students have to pay for insurance too. It's just they don't get the foreign health because they have the MCP, so they get this plan through the union. You actually already have the GS dental, right? So if you look at your account, you'll see SU. The reason is that all have that dental, all grad students have that plan because MCP is not a requirement for that plan, okay? But the health plan that the GSU administers, you have to have that MCP, okay? It is very different coverage, right, from the foreign health and from MCP. So the student union plan does not cover anything MCP covers because the idea is you have to have MCP to have that insurance. Whereas the foreign health will cover things that MCP covers, right? And the foreign health will also cover things not covered by MCP, but the foreign health does primarily just for emergent situations, right? So it has some exclusions around pre-existing conditions. The student union health plan does not have those exclusions, right? So it's more than a 60-day supply of medication, right? They don't have those exclusions. So there are benefits for students if they get MCP to switch from the foreign health to the student union plan, because you can perhaps get more prescription drug coverage and that sort of thing, right? With the student union plan, because there's not the same restrictions. However, there's also things you give up from the foreign health insurance if you switch to the student union plan. So the foreign health insurance is designed for people who are not like permanently residing or residents of Canada, right? And so because of that, there are a couple of benefits. One is a family transportation benefit. So if you became ill and you were hospitalized for a period of about 7 days or more, There is a family transportation benefit. So it can fly a family member here in Canada and pay for their accommodations and have them with you as being an inpatient in the hospital. There's also a repatriation or burial benefit as part of the foreign health, where if you were to die in Canada, it would fly your remains back home, right? Those benefits are not part of the student union plan because that's designed typically for somebody who, you know, is a longer term resident in Canada and has that MCP, okay? Now, the student union plans are less expensive than the foreign health because the foreign health will cover the MCP plus, this covers the kind of plus part, right? So they're very different coverages. So we have heard from the Graduate Student Union, they do really want anybody who's eligible, who has MCP, if you're a grad student, to opt out of the foreign health and switch to the student union plan. Ultimately, it's your choice, right? Because you have to take action to switch your insurance. But our undergrad students, you know, it's more or less kind of optional, but the GSU would really prefer it if the students who were eligible were in their plan. It's important though that you understand kind of the differences, and because your student union plan is tied to you having that valid MCP, MCP covers you in the province of Newfoundland and Labrador. If you go out of province, you might be able to get out of province coverage, but it's limited, right? So if you're someone who may be traveling or have lots of work terms or things like that, you might want to consider staying in the foreign health. But the option is there if you get MCP to opt out of the foreign health and switch to the student union plan. I didn't tell you I was going to quiz. So for people who are joining us through WebEx, if you want to just type quickly into the chat, it's just a true or false. So just want to make sure and check in for folks that they're understanding. So first of all, tell me just quickly by shouting it out to the first statement, do you think it's true or false? So foreign health is optional for registered international students. Is that true or false? False, that's right. Yeah, it is mandatory. 2, I maybe not have said this directly, but foreign health only covers you in Newfoundland and Labrador. Is that false? Right. So the foreign health insurance plan is designed to cover you anywhere in Canada. And it'll also cover you in some cases if you are outside of the country even, depending on how long and where you're going. All right, 3, you can apply for MCP before you come to Canada. Is that true or false? False. False, okay. And why is that false? Because one of the eligibility criteria is that you are a resident, right, of Newfoundland and Labrador. Next. All right. So now on to the next phase of the presentation, which is just about how you opt out of the foreign health. So for some of you, again, this is not an option, right? Because you don't get MCP, you're here, so you can't cancel it. It is mandatory. There are very few reasons why we allow somebody to opt out or cancel the foreign health. One is if you have a valid MCP and you want to transfer to the student union plan, right? 2 is if you're studying outside of Canada. So our students who are doing online courses will not be coming for the winter semester. They really should opt out because you're not getting any benefit from the insurance. Other eligibility to opt out, there are a couple. We accept a couple of forms of alternate insurance, but they're for individuals who are here as part of sponsored groups. So we have some international students who are refugee claimants and have federal health insurance through the government of Canada. And we have some scholarship sponsored students from a couple of different groups who come as part of an insurance package from Canada as well. But we don't accept, like, if you had insurance from your home country, you know, while you came and were here, or other types of insurance, right? It is essentially if you're not here, or if you have the MCP and you want to switch out. Okay. So in terms of opting out based on having MCP, so you have to be a full-time student and your MCP has to be valid on or before January 1st, 2024. It has to be valid on or after January 18th and subject to renewal. So the subject to renewal part you can assume is going to be true, because typically what MCP does is they give you MCP for 1 year at a time, even if you have a 2 or a 4-year study permit, right? If your program is longer, they give it to you typically for a year at a time, and you have to extend it prior to expiry. They want you to be able to demonstrate again that you're still eligible for that MCP. You're still full-time, you're still residing in the province. Now, the January 1st is the date that our foreign health insurance coverage begins, right? So we're not going to let you opt out of the plan if you don't have coverage for that period, okay? So for students, when it's your first semester, it actually can be very difficult to meet these eligibility criteria. You might not be able to opt out of the foreign health and switch to the student union plan in your first semester, but we will allow you to do it in the next semester. So we do an opt-out period every fall, every winter, and every spring, okay? So the reason why you might not be able to meet the January 1st is if you arrived in Canada after January 1st, typically, or however MCP then issues the MCP. Sometimes they do it after 1st of January, okay? But what will happen if you are eligible to opt out? The opt-outs are done online. So everybody, if you have registered, you might have gotten an email from GuardMe already. And if you haven't received it, you will receive it soon. So typically a week or so after you register, we'll pre-register for your courses. We'll pre-enroll you with the insurance company. And then the insurance company will send like an introductory email. Okay, you'll be set up on the insurance. You might be eligible to opt out. And the email explains it all. You know, if you are, go to this website, and the deadline is January 18th. Okay, so you just fill in the opt-out form online. They're going to ask you for the start date and end date of your MCP. There's some information you have to attest to, so it's important that you read it. A lot of it is a reminder, you know, don't let your MCP expire. If you're out of province, you might not have coverage, that sort of thing. And then they'll receive your opt-out. They'll take a couple of days to review it. You'll get a separate email to say you've been approved for the opt-out or you have not been approved. So if you have been approved for the opt-out, what will happen is after January 18th, we will adjust the fees in your student account. So the foreign health fee will get removed and the student union health and dental plan will go on to your account, okay? After that happens, it might take the student union a week or two to then activate your policy with Green Shield, but they will go retroactive to January 1, okay? So if you get approved for an opt-out, nothing happens immediately. They all get processed at the same time. After January 18th, the fees get adjusted in your account, and then a week or so later, the student union, when they're enrolling everybody, you'll be enrolled, and that coverage will go retroactive to January 1. Okay. And for those who are outside of Canada, the opt-outs are also online. It's a different kind of declaration form because it's about, you know, confirming that you are outside of Canada and not about the alternate coverage. For those students, if they get approved for the opt-out, then the fees will be adjusted after January 18th, but the fee just gets removed. It's not replaced with the student union plan because you're just opting out based on being outside of Canada. Opt-outs based on being outside of Canada have to be done every semester. When you opt out based on having MCP, it's good for the rest of the academic year. So an academic year runs from September to August, right? So now we're in the winter semester. If you do opt out, it will expire in August 2024, which means every fall we reset, basically. You have to opt out again. Okay? And as I mentioned, in terms of other eligibility to opt out, it is very narrow. Some of our refugee claimants or from our Libyan scholarship program who have Canadian mandated insurance, we allow those students to opt out. It's online and the deadline is January 18th. Okay, so that's about the opt-out. All right, so again, for those online, just type into the chat super quickly, true or false, and you guys can just shout it out. So number one, having MCP is adequate health insurance. Is that true or false? Kareen works. So, I mean, it's false. It's great coverage to have. It's free. We really encourage you to do it. But as I said, anybody who can afford it will typically have additional health insurance. And healthcare in Canada is very expensive, right? I mean, the most expensive things obviously are those things that happen in a hospital, but prescription medication, dental care, it's very expensive. And so from Memorial's perspective, you need more than MCP. Our Canadian students need more than MCP. All right. Okay, I should have changed this to February. 2, I can opt out of the foreign. What's the deadline? January 18th. 3, I have insurance from my home country, which means I can opt out of the foreign health insurance. False. Right. I like these false for health. Okay. And I didn't discuss this in any great detail, but anybody who has family, this will be important. So we refer, typically the definition that's used for family refers to your immediate family, your dependents. So spouse, common law partner, or dependent children. Okay, so we're not referring to parents or siblings. So as I mentioned, if you have dependents, you can include them in your MCP application. They have to have an immigration document also valid for the next 12 months in order to get it, okay? So we have situations sometimes where the student gets it, the family comes later, and they don't get MCP because their immigration document is not valid for long enough, all right? If you and your dependents have MCP and you transfer to the student union plan, after you do that transfer, you can go to the student union and add your dependents to that plan, right? So you guys can have the same coverage. Now, you don't have to do that. As a student, we make it mandatory for you, but for your family, that's up to you, right? I would certainly encourage it for all the reasons that we mentioned. Healthcare can be very expensive. The idea with insurance is you don't know if you ever have to use it. You hope you never have to use it, but it can really help to cover those very large expenses, okay? But of course, it will cost you extra to add your family into the plan. Now, if you stay in the GuardMe plan, okay, then what will happen is after January 18th, if you don't opt out and you stay a registered student, because January 18th is also the last day that drop your registration. So after January 18th, if you're still registered, you didn't opt out, we then also finalize your enrollment, right, into GuardMe. And typically it's the end of January or the first day or 2 of February, you'll then get a second email from GuardMe. And that second email will be your healthcare access card. It's also going to go retroactive to January 1, right? So you have the coverage. It's just you don't have access to the policy until we finalize the enrollment. And once you get that email that says, here's your healthcare access card, you have 10 days from getting that email to add your dependents to the plan, to be able to add your dependents retroactive to January 1. You can add your dependents at any point in the future, right? But their coverage then becomes effective like the next day. But once you get your healthcare access card, end of January, early February, you have 10 days, you can add your dependents and go back to January 1. There could also, and it's done online, so you pay the insurance company, right? Your insurance, you pay to Memorial, and we pay it back to the insurance company. But if you're adding dependents, you're typically always paying the insurance company or the student union in the case of their plan directly, okay? Sometimes it can happen that you have MCP, but your dependents don't. So it could be that you opted out of the foreign health and went to the student union plan, but your dependents can't get the student union plan because they don't have MCP. You can purchase GuardMe insurance for them. All right, so there's a way through the GuardMe website to purchase the GuardMe insurance if they're a dependent of somebody with GuardMe or a dependent of somebody with MCP. The policy they get with GuardMe is slightly different. But again, I would strongly encourage that. You certainly don't want your family here without any coverage, right? The difference is, of course, the GuardMe won't cover a lot of those pre-existing conditions, okay? Of which pregnancy is one, right? So it's important to just think about that coverage for your family. If you have questions, you can ask me at any time. Okay. All right. So now, yeah, go ahead.
In terms of,
So it's sure. So it depends again if you have the GuardMe and you're kind of adding them to the same policy, or if you've opted out of the GuardMe and then you're just purchasing for your family because they don't have MCP. Because the policies are a bit different, the one you have, and if you keep it, you add your family, it works out to be $2.15 a day. If you don't have it and you want your family to have it, it's like $1.70 a day. So it's basically like if you keep the $261.59 works out to $2.15 a day for the semester. So it's the same price per person. It's not like adding independent makes it less expensive. That helps. Yeah. All right. So now we're going to talk about some GuardMe services. So this is where you guys are here for a semester, right? You can pay attention again. A lot of that other stuff might not have been relevant for some of our exchange students. But GuardMe has a few different programs. So if you stay enrolled in the plan, as I mentioned, end of January, early February, you'll get an email from GuardMe that will say, here's your healthcare access card number, here's your policy. And you can go then to their website and create an account online. So you can kind of download all those documents. I would recommend the healthcare access card. It's like a self-print thing. So you should print it and have it with you, right? That way you can present to a doctor or to a pharmacy. They are set up so that these places can bill GuardMe directly, so you don't have to pay and make a claim. But sometimes it happens that the physician or medical office you're going to, they don't want to do that, or they're not set up that way. But you definitely need your healthcare access card to even try to do a direct bill. Now, if you see a doctor on campus, they will definitely bill GuardMe directly. Okay, but you want to create your online account, because if you need to, if you have a receipt from something, you can make a claim and you can then download your policy. They also have a program called Mobile Doctor. So this is only available if you stay enrolled in the GuardMe plan. So Mobile Doctor is where you can have access and meet a physician virtually. So I think it's phone or video chat. And they can write prescriptions as well and send a prescription to your pharmacy of your choosing. Okay, so you can get some treatment, some diagnostics by seeing a doctor virtually. So it is a really great service to have because Canada is in a healthcare crisis at the moment, where it can be difficult to access some of these primary care services. You're very fortunate as students at Memorial to have a clinic on campus, right? There are a lot of, when I say crisis, there's a lot of Canadians who don't have a primary care physician. So this is just another way, another point of access. So Mobile Doctor is only if you stay in the GuardMe plan. Keep Me Safe is a service that's actually available to all students at Memorial, so Canadian and international. And this is a mental health counseling service, all right? Now, again, as students at Memorial, there is the Student Wellness and Counseling Center, so there are on-campus counselors, but Keep Me Safe, again, is another option. And what's really interesting about Keep Me Safe is it's multi-platform. So you can speak to a counselor through chat. You can speak to them on the phone, video. You can, if they can, they'll try to arrange for you for an in-person counseling session. They offer them in a variety of different languages. So, and you can also be culturally matched as well with a counselor. And it's great because, you know, it's 24/7 as opposed to the counseling center on campus, which is Monday to Friday, kind of 9 to 5. All right. So I encourage you to become familiar with that. And Gardening also has a Gardening Cares program. So there are, they're volunteers actually, they're MUN students, and you might see them at different events, but they're there to help promote and answer any questions you have about the insurance. So that's kind of the online account, the mobile doctor, Keep Me Safe, and Administers. Okay. All right. So again, quickly, if you think this is true or false, to make a claim, I can only do so by mail. False. Yeah. With Gardening insurance, I can only see a doctor virtually. False. Yeah. So you can still see a physician at the Student Wellness and Counseling Center. You can see physicians elsewhere, but we'll talk about accessing healthcare services. If you're seeing a doctor, it's going to be mobile doctor or likely at the Student Wellness and Counseling Center. And 3, I need to be enrolled in Gardening insurance to avail of the Keep Me Safe. This one's false. So you need to have Gardening insurance to have mobile doctor, but all students at Memorial have access to Keep Me Safe. Okay. All right. So in terms of seeking healthcare, so the way that Canada's healthcare system is arranged is that you have kind of primary healthcare physicians, and then you have specialists. So it's not possible to directly book an appointment with a specialist. You would need to be referred by your primary care physician. Okay. And a primary care physician is typically referred to as a family doctor, or what somebody might call like a general practitioner. Okay. So typically people will have a family doctor, and they have them hopefully for their whole lives or until that doctor retires. And so anytime they don't feel well, they can book an appointment or go to their clinic, you know, and see the physician. The primary care physician or family doctors clinics aren't necessarily in a hospital, right? They have private clinics around the city that they operate, and you can see a doctor there. If the doctor can treat most anything, you know, but there are things that they might say, okay, well, I need to refer you to a specialist. So perhaps you need to see a cardiologist or a dermatologist, or, you know, anything like that. You get referred by the family doctor, primary care physician. Typically, it has been that it's the physician who can do the treatment and can write prescriptions. But the healthcare system is changing in that there are now other medical professionals that can do that. So you can actually visit a pharmacy, which is where if you were given a prescription, you could get it filled, I guess, and get that medication that the doctor prescribed. But pharmacists can prescribe some medication as well, right? Not everything, but there are certain things that they can give a prescription for and then fill it as well. And also at a pharmacy, you know, there's prescription medication. There's also what's called over-the-counter medication, which you don't need a prescription for. And over-the-counter medication is not anything that an insurance would cover. It would be something you'd have to pay out of pocket. But perhaps, you know, you can also go to a pharmacy and speak to a pharmacist and say, you know, I have this cough, or here are my symptoms. They might recommend an over-the-counter medication as well, right, to help with that treatment. So the pharmacists can do some of the primary care diagnosis. There's also different types of nurses, and this I don't have a great education about, but I think there's like practical nurses and licensed nurses. Some of them can provide prescription medication and can administer vaccinations and do different things. And so what you'll see is in some family doctor clinics or primary care physician clinics, they will also have nurses there. So sometimes your appointment is with a nurse if it's to get maybe, again, one of those simple prescriptions or a vaccination or that sort of thing. So at the Student Wellness and Counseling Center on campus, there are nurses there, there are family doctors, there are counselors as well. Okay. Then you have like paramedical or other medical services. So a paramedical would be like a physiotherapist, massage therapist, or chiropractor, right? So sometimes for those they're not medical doctors necessarily. You don't need that referral from your physician. They're not that type of specialist. You can book an appointment with them directly. But sometimes insurance companies won't cover those services unless you have been referred by that primary care physician. So you need to be careful about that as well. So in terms, it's a bit of an explanation, and then where do you get that? So as I mentioned, most family doctors will have clinics, within the community. It's very difficult to get a family doctor. There are a lot of Canadians who don't have a family doctor. Very fortunately for students at Memorial, you have a family doctor automatically. You don't have to go find one. They all work at the Student Wellness and Counseling Center. So they're there to be your clinic. And if you have your family with you, they're your family's clinic as well. Okay, so you can book an appointment through the Student Wellness and Counseling Center to see a physician, okay, or a counselor. There are, like I said, there are external clinics to that. It can be very difficult, if not impossible, to find a doctor who is your doctor for the time you're here. That's why we would recommend the Student Wellness and Counseling Center. But there are some clinics which are like walk-in clinics. I think there's 2 that I'm aware of, that you don't have to be a patient of that clinic. Anybody in the community can go to, okay? So there are a couple. Typically you would have an appointment, but sometimes you might not get an appointment right away. And so you could be tempted to go to an external clinic, to another walk-in clinic, okay? And another option would be the emergency department in a hospital. So on campus, we have the Health Sciences Center, which is the biggest hospital in St. John's. There's a couple of other hospitals as well, but they would have an emergency department. So you could show up to the emergency department and get seen, but it is designed to see you like only if it is urgent. Right? So if you can wait, you make an appointment and see the doctor of the Student Wellness and Counseling. If you can't, then you go to an emergency room. Unfortunately, because there are so many people who don't have a primary care physician, a lot of things that people might be able to wait for to see a doctor ends up bringing them to the emergency room because they have very little option. So as a result, and they triage, right? They see people that are really urgent. You could experience very long waits. Okay, so it's not, it is designed for emergency. I am not going to be able to tell you if you should go to an emergency room or to see wait for an appointment for a week or so. If you're unsure, if you are not sure about that, you can call the health line. So if you dial 811, you'd get connected with a nurse, with a registered nurse. And the idea is it's not for like treatment or diagnosis or prescription. It is just kind of for advice, right? So I have certainly called it sometimes, and say, oh, my child has this sort of rash, and they might ask some questions, and they sometimes recommend, well, yeah, you should see a physician in the next few days, or you should, go to the emergency room. You can't wait. So you could call the helpline and get that type of advice. I think this is my last quiz. All right, so 1, it's easy to get a family doctor outside of the university. I think I made that very clear. 2, I can directly make an appointment with a specialist. False, yeah, you have to see your primary care physician. Okay, so now we have lots of time for questions. If you don't have questions, I hope you still found the information useful. You don't have to stick around. If you want to go, if you want to get up and stretch. I know I've talked for like an hour. But if you do have questions, let me know. And I'm going to stop sharing so I can open the chat.